Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about types of knots. Okay, we have square or reef knot, which is actually a secure knot. Okay, first you will take it something like this. Next you will square the knots. This will cross above and this will below. This is actually a square knot. Okay, now you have made a square. Now we will reef over this square knot. So this is the now we will form reef, that is you will take this edge and you will take this edge and make a reef. So see, so this is the one edge. Okay, this is the, so I will just so this is the one and this is the which is going down, and this part will go like this. Okay, now this is square and now you are reefing it over here again. So I'll draw it again so that this time I'll draw it properly. So this is one. So this is okay, this is something like this. Okay, this is square or reef knot. Now the next type of knot which we have is called as granny's knot or slip knot. Here there is reefing is there. In granny's knot there is no crossing and it is an insecure knot. Insecure knot is granny's knot, where you will not see any reefing. And the next important secure knot is surgeon's knot. In surgeon's knot is actually secure. Here you will do it two times first followed by once. You will put the knot 2 times first followed by once. This is one thread which you will see, and the second thread will be something okay. So these are this is surgeon's knot, where you will see 2 knots, four, this is 2 knots and 1 knot. Okay, this is surgeon's knot. Now we'll learn some important points about skin suturing. The skin is sutured with inverted edges and skin, whereas bowel has inverted edges. So for skin suturing we use 3 instruments are used. What are they? We use needle holder can be used, or we can use the forceps is used for skin suturing. Then we use straight scissors are used for skin suturing. Okay, then we can have 2 types of sutures are present. One, we have simple sutures can be put. Simple sutures are mainly aimed at averted edges. The main aim of simple sutures is to just make sure that the two edges are approximated with each other. Then we have mattress sutures. Okay, this mattress sutures, this is something like this. You will have two suture edges. Now you will go down and then come back, and then here the sutures will be on either sides. Instead of, see, simple sutures will be, this is the two approximated edges, they will be like this. Okay, mattress sutures will be on either sides of the sutures. Okay, so these mattress sutures are of two types. One we have eversion and homeostasis. One is horizontal suture, the second we have vertical mattress sutures. Right, now if there is one important formula which is important, if x is depth of the wound, if x is depth of the wound, then the distance between wound edge and knot, the distance between wound edge and knot on each side should be x, and also the distance between two sutures must be 2x. Distance between, see, if the depth of the wound is x, then the distance between the two knots, if this is the wound, if this is one knot which you have put, second, third, fourth, the distance between the two knots should be x, and the distance between the two sutures should be 2x, and the distance between the wound and the knot, this is wound, this is knot, if you put it here, that is x. The distance between the wound and the knot should be x, the distance between the two sutures should be 2x. So this is one important thing. Thank you for watching.
Thank you, and thank you for watching.